Hello, everyone. It's Dr. Nirav Pandya. A lot of people have questions about Gary Payton II's return and what goes into determining when a player with an elbow injury in general, such as his, can actually return to play. Here's a quick breakdown once again in the next couple of minutes about his elbow injury, what to expect when we're returning a player to play, and what things we should look for in terms of performance. Now, the first thing to understand is when Gary Payton II hurt his arm, it was basically a fall onto an outstretched hand. What happened is that there typically was a lot of force that went through the wrist and forearm up to the elbow, injuring the structures in the elbow. Now, what the Golden State Warriors reported was that he had a fracture in his elbow, as well as soft tissue damage involving the ligaments. Now, typically for a broken bone, regardless of where it is, the key thing is determining whether you need surgery or not. Obviously, Gary Payton II did not need surgery, which typically means that this type of elbow injury probably means that the fracture was minimally or non-displaced, meaning that the bone itself was not out of alignment. Now, in general, we know that bone healing takes about 6 to 8 weeks to fully recover. In addition, soft tissue or ligamentous injury also takes about 4 to 6 weeks as well to calm down. And this can vary a lot based on the exact injury pattern. But generally what happens with bone is that there is healing that's occurring week by week, typically right around by 4 weeks. There's enough bone in place that athletes in general can begin doing some sort of type of sporting activity. The key is determining where that break actually is and how stable the bone is given how much healing there is. So what this means is, even though an athlete may not have an elbow fracture that is fully healed, there may be enough callus, which is basically new bone around the fracture, that the risk of the bone moving out of place is minimal, and doing normal basketball activities won't necessarily impact the healing process. Now, once the doctors give the okay based on the exam, based on the radiographs, and based on what the player is saying, then there's a general ramp-up period, just like with a lower extremity injury. Athletes need to basically have full motion, no swelling, good stability, and the ability to do basketball-specific activities. Now, in general, whenever an athlete has an elbow injury, the number one thing that you're going to see impacted, particularly for a basketball player, is going to be dribbling and shooting. Now, from a defensive standpoint, Gary Payton II should be able to do everything. Yes, there may be some discomfort if he gets hit in the elbow, and obviously you want to avoid a large fall to the ground, which would cause things to get re-aggravated. But from a defensive standpoint, given that he was able to stay conditioned and that he was able to do some more vigorous cardiovascular activity, that shouldn't necessarily be impacted. The largest thing we're looking at is in terms of how he can shoot and how he can throw the ball. Now, just like a pitcher, whenever there's an elbow injury, the greatest forces come across the elbow when you're doing those motions, particularly when you're shooting from a long distance range. So even though the player may be cleared to play, there can be certain parts of the offensive game which may particularly be impacted, in which basically the training staff and the player know best in terms of how it feels, if there's any residual discomfort, and whether he has the strength to do so. Now, it's important to understand just because a player may be having discomfort or not having discomfort, the elbow may actually respond with discomfort after a period of play. This is due to the fact that even though an athlete may be doing some sort of physical therapy or maybe working on motion and strengthening, just like with the lower extremity, when it's first impacted in a basketball game, there may be some soreness just simply from not using the elbow. The key is, number one, determining what the risk of that fracture is, or any kind of ligament injury in the elbow is, of getting worse. Number two, how effective the player can be. And number three, how does that elbow respond after playing in a game? And does the player have confidence to basically perform effectively, knowing that there could be a risk of re-injury if the player does fall hard on the ground? Hopefully we see Gary Payton II back in the game today, but there are various multiple factors that go into making the determination of whether a player can play in general coming off an elbow injury. Thank you.